Hey guys, Dr. Soni here. Today we're just going to do a little bit of Botox, and today I'm going to talk about the pain associated with Botox injection. First of all, there should be minimal pain associated with it, but there are some things that I do a little bit differently that really make this procedure quite comfortable. First of all, I really like these BD insulin syringes, and it's a very small needle. It's a 31 gauge needle. The other thing I like to do is when I move from area to area, I change my needles. I know that sometimes injectors will, get a 1 cc needle and draw, all the Botox or Dysport they're going to inject. And oftentimes they're using a needle with a hub on it that they attach to the needle. And they're using the same needle to inject over and over again. Remember, with repeated injections, the needle tip gets dull, making the injections actually more painful. So it's very important to have a very sharp needle because that makes it less painful. And so we're going to start in the center over here. And again, 1, 2, 3, tiny pinch. Great job. And so that's one shot. 1, 2, 3, tiny pinch. Great job. You're doing great. And this last injection is superficial. Pinch. Great job. And so out of this needle, I just got 3 injection points, and now I'm done with it. And I'm going to switch to finish out the glabella. So we're going to finish out the glabella, and we got 2 pinches coming up. 1, 2, 3, pinch. That medial glabella, it is a deep injection because the head of the glabella originates deep, and as it gets laterally, pinch. It's a little more superficial. And that's it. Center part is done, and that's the second syringe we're just going to toss because we've only used it twice. And again, this keeps the procedure with minimal pain. Next, we're going to do the forehead whenever possible. I like to keep my injection points very high up. Again, especially if there's a little bit of hooding, the closer you get to the brow, sometimes you can make it a little bit heavier. Whereas if you're closer to the hairline, at the line of convergence, or even above it, you're less likely to create that brow ptosis.